So I grew up around a lot of medical professionals in my family. My dad is a veterinarian and he has a great friend who is a surgeon. And I was inspired by him a lot. So when I was growing up, by the time I was 7, 8 years old, I knew that I want to be in medical field and I want to be a surgeon. But obviously then I went through all the studies and all that, took the exams back home in India, went for an interview to go to the college. And when I was with the advisory board there, and one of the doctors mentioned that, have you thought about dentistry? Because one, my sister and one of my daughter, they both are doctors. One is an ER doctor, one is a gynecologist. And I see them that they struggle with their family life and all that comes into play. And then I was like, okay. And then, all of a sudden I was like, okay, then I'll go to dentistry because I like seeing people smile. This is something that really attracts me. Even back then, I always looked at people's smile first for whatever reason. And now I know what was the reason. So that's how I got into dentistry. So we pretty much offer all aspects of dentistry, including preventative care, which includes patients coming in, doing their routine exams, their checkups, their cleanings. We also see children as well too, starting from age even 1. So we see patients from age ranges from 1 to until they have teeth or they don't have teeth, as long as they are alive. We see everybody. And we offer what we call a restorative dentistry, which includes filling work, crown and bridge work. We also do dentures, we do implants. So those are the areas. We also offer teeth whitening. And I also work on cosmetic cases as well. If somebody wants to really have a makeover of their teeth, I do cases like that as well too. So that we pretty much offer all range of dentistry. For me personally, I love seeing the smile makeovers. It really takes, it's amazing when I see the results from patients, how they come in, how much it affects their own mental state. Like they become so much better. They are so uplifted seeing how they were before and after they are, how they look after. So that is one of my areas where I so love, and I also train myself a lot into that area as well too. That means to me is that we are able to really connect with our patients. When we are seeing our patients, before we even see them, as soon as whether they text us, whether they email us, or whether they're calling our office, we are connecting to them as a person because my main purpose is to get them healthy. I want to help them, and also my team help them to achieve their optimal dental health so they can live happier life. So that is one of the biggest differences that I see personally, and also my team feels that way too, is that we are really getting that patient in as a person, and we are really connecting with them, and we are there to help them throughout their dental journey. Oh, that is one of the most important elements to me. As we say that, one person cannot do anything alone. So I need my team. They have to be with me all the time. They're my left and right shoulders. I always tell them actually that too. So, as I said, like even whether patient calls or texts or emails, there's one of my team members who is responding to them. So we are all connected. We do a lot of training together, we are always looking to improve ourselves so we can provide the best care to our patients. So team is very important aspect of, as a doctor, so they can get my message across to my patients. We are able to help our patients the best we can. Personally, to me as a doctor, because I know about dentistry, there's a lot of, nobody wants to go to the dentist. We know that. If I was a dentist, I probably wouldn't be one of them as well too. So I completely understand that feeling. So in order for us to help our patients, we have to make sure our environment in the office, not only in the office when patients come in, but also when we speak to them, we want to make sure that we are really there for them. We are able to comfort them and make sure that they get that they can come into the office. It's safe for them to come. It's not going to be that dreadful environment. We're trying to make them as comfortable and as, happy and cheerful, and we make jokes with them. So it doesn't feel like it's we are in the dental office. So again, as I said, we train our team, we work on those things. So we are making that environment safe and happy for them. So they not only come once, they keep coming so that they can stay healthy over time. So there are multiple things that can be done to overcome patients from the fear of dentistry and anxiety they have. The very first thing is, when we even take the new patients call, there's certain, we might kind of touch upon some things that, they had, what kind of experience they had in the past. So we better prepare ourselves so we know how we can walk that patient through and how we can help them doing various things, maybe just bringing them in to meet with me only or meet with my hygienist so they can understand and they can get familiar with us. A lot of times, even offering them that, it actually takes their anxiety of that, yes, it's okay for me to go to the office, talk to somebody. They're actually people as well, too. So that takes that, anxiety off a lot of times. When I meet with the patients, if they're needing any treatment, even at that time, I'm asking certain questions so I know that, okay, how, if they had any experience in the past or how they are. Or sometimes patients tell, on their own that I'm so afraid of the needles. So I kind of walk them through the process. Okay, what can I do? I used, like, even some of my patients are like, I didn't even feel the needle came in. So there's ways we can, use some music. We have like noise canceling headphones. We give them, tell them to just go into your happy place, just leave your body here and let me do my thing. Give them topical gel. I use different kinds. So making sure that depending on what patients' needs are, and I have different kinds of needles that I use, not that I want to say that word, but, that helps them to lessen the feeling that they can have. Yeah, so very much so, like, your overall health is related to your dental health. We knew that many, many years ago, but it was not many links. There were not many studies. It wasn't much published. It wasn't much talked about. But as we are coming across more diseases like diabetes, heart diseases, a lot of brain conditions like Alzheimer's, Parkinson's disease, there's more and more relations are coming up and there's more and more awareness about it. So, anytime patient comes in, or even our existing patients, we always, educate them that how important it is to have their teeth healthy, their gums healthy, so they can avoid all those things, whether they have it now, that will reduce the severity of it. And if, obviously if they don't have it, they can prevent those things from happening. Yeah, many of the other things, actually, one of the biggest one that is like, mothers who are about to have babies or, they have, having to have it, just like, low birth weight and many other, conditions can be related to those. Besides those, there could be many others which we don't know. I'm sure we will get to know them. So people with healthy teeth and gums actually live 10 years longer than people who don't have that. So we might definitely want to make sure that you don't have any periodontal disease, so it's not affecting your other systemic health as well too. So some of the indicators could be, very common amongst people normally know are like, if their gums are bleeding, your gums are swollen. Other times could be that if you're feeling like dry mouth, you're seeing like some, like a darkness around your gum line, or you're seeing any swelling around your face, your cheeks could be, even the bottom of your jaw is getting swollen. In general, like a lot of times actually people who are feeling low energy could also come from people with periodontal disease and the bacteria coming all throughout their body. So those are some of the things that you want to be watchful about. So if you're looking for any help or if you have any problems that you need to see the dentist for a regular exam, we are here to help. Our office number for our Hampton location, Smiles by the Sea, is 603-926-8827. And for our other office is Smiles of Salem in Salem, Massachusetts. It's 781-631-3799. Give us a call. We are here to help you.